1990 to now, we've seen child mortality halved in that space of time. So in 1990 we had about 12.5 million children under 5 who died each year. Huge number. Today that number is 6.6 million. So in some countries they've seen child mortality decline by up to 70%. So that's an extraordinary achievement over our lifetime. One of the big things that the successful countries have done right is they've empowered women, and particularly young girls. So they've kept girls in education, they've delayed early marriage and early childbearing, they've made sure that the economic growth in those countries has translated into jobs for young women. So women have had an income, often for the first time. So Bangladesh is really the best example of that. They spent many, many years working directly with very poor women, educating them about contraception, teaching them to read, and then those women got jobs. As the economy grew, they got jobs, they had their own money, and when women earn money, what they tend to do is put it back into the family. So they educate their children, or they buy more nutritious food to feed their children, so the whole community benefits. So women's empowerment is a huge part. It's not all of the story, but it's a huge part of the story. So people tend to think that when children die, it's sort of random, it's a random occurrence. So those child deaths are sort of sprinkled throughout the population. It's not the case. Many studies over many different countries have shown that it's a small minority of mothers who tend to have the majority of child deaths. In Nigeria, in northern Nigeria, one study found that 20% of the mothers had 80% of the child deaths. What that means is you have a tiny group of mothers who are losing not one child, not 2, but 3, 4 children. And we have to understand why those group of mothers are losing multiple children. It's called the death clustering effect. It's well established, but I don't believe the global health community has really come to terms with it, because we certainly don't have policies that can identify those women and surround them with the package of services that they need, because it isn't just health services they need a whole lot of support, because they're extremely vulnerable and often ostracised women. You would think that this population of mothers would be very poor and very uneducated, and that's true, but that doesn't explain the death clustering. What explains the death clustering is the lack of social support that these women have. So yes, they're poor and uneducated, but they tend to have a lot of children, 5, 6, 7 children, and they can't call on anyone to help them with those children. So for a number of reasons, these women are alone, trying to raise these children alone. Often they don't have the support of a male father, they don't have relatives who will support them, so they can't call on extended family. They're extremely isolated women. They're also the women who are often secluded in the home. They don't leave the home to seek health services. So to reach them and to help them, you have to come right into the home. And that's very challenging and something that our health systems have often struggled to do. Well, the good news is over the last 15 years there's been a dramatic increase in funding for global health. A lot of that has been driven by the Bill and Melinda Gates Foundation, by the Global Fund for AIDS, TB and Malaria, and by Gavi. Huge increases in health funding. However, a lot of that funding was not well targeted to child survival. So a lot of that funding made its way through the health system but wasn't actually targeted to the leading causes of child death, which are pneumonia and diarrhea, malnutrition, and newborn death is a huge problem now, newborn death. So we need a global health system that is properly matched to the leading causes of child survival. And that hasn't happened yet, but I'm hoping in a post-2015 environment we get much more strategic about matching new resources for global health to the leading causes of child death. It's the only way we will eliminate preventable child death. What a great question. If I was given a blank check in global health, I would go out to India, to Nigeria, to Pakistan, to Congo and Ethiopia, to those 5 countries, and I would find the mothers who were most at risk of losing a child or who had just lost a child, and I would surround those mothers with social support, with health services, with education, and with the ability to earn their own incomes and control their own money. And I would not stop until I'd reached all those mothers. And I would be absolutely confident that by doing that, you would be not only putting a woman's life back on track, but protecting all of the children that she will have into adulthood.